Hi, my name is Dr. Zebi, and I'm going to explain in simple words what are the STIs. I'm not going to go through every single one of them. Five most common ones are chlamydia, mycoplasma genitalium, herpes simplex 1 or 2, and HPV, human papillomavirus, and syphilis, which is on the rise, unfortunately. There are other sexual transmitted diseases as well. You may be wondering, Hep A and Hep B can actually be transferred via sexual contact. Obviously, HIV, those serious diseases are rare, can happen, but usually it goes through people with IV drug abuse, unfortunately. You just got to make sure you're not going around those kind of guys, men or women. They have needle marks in the arm, so you just got to be careful if it's a random contact, basically. A couple of things you can do to minimize the risk. Using condom. Obviously, condoms are not always accessible. So what happens if you go somewhere and you don't have the condom, and here you are. So the best approach is make sure you put a moisturizing cream on around the groin area and use lubricant. Lubricant is very useful because it makes a film, very thin film, which is very thick for the length of the virus, right? So the virus doesn't have a drill right away, boom, goes and attaches to your skin. So it is important to use some kind of protection, and the lubricant minimizes the risk of friction and causing harm to the skin as well. So without lubricant, you just got to be careful because it's easy to scratch the skin, and then the blood comes out. You don't even see that, but then the viruses and bacteria are free to get in or get out. And make sure after having sexual contact, you go and get shower. This is very important because that washes away and doesn't basically give time to viruses or bacteria to attach to the skin. If you sleeping it over after a couple of hours, then that gets dry, and there is more chance of getting the STIs then. But if you go to toilet right after, passing urine, which is one of the defensive mechanisms of the body, is passing urine right after. Even if you had you've gone to toilet before sex, half an hour later, you still feel that you're going to go to toilet. So that's one of the defense mechanisms that washes away inside the canal, urinary tract, basically canal. And once you get a shower, everything is washed out. Simple. And make sure before having the contact, you take a look at the groin area. If it's any ulcer, any cuts, any red spot, herpes, what it looks like. It looks like a bunch of red spots next to each other. So that's important to know if the skin is intact. I wouldn't shave right before having intercourse with somebody that you don't know, because shaving takes away a couple of layers of skin. So you are more susceptible to catch something on the skin, i.e. herpes simplex virus, right? So make sure you don't cut yourself when you're trimming that area, okay? This simple stuff gonna save you a lot of hassles, getting to doctors, antibiotics, antiviral, those kind of stuff. For the Hep B, most people nowadays, they are immunized against that. Hep A, you can get vaccine. lasts for 3 years. For the HPV, there's a Gardasil vaccine for it as well. So, and syphilis, you need antibiotics if you catch it. You get an ulcer around, 3 weeks after, and then that ulcer disappears. You feel okay, nothing wrong, and all of a sudden, it takes a bad turn later on. So that is important. Anything that comes up as an ulcer around that area, you go to doctor and make sure you discuss that matter with your doctor. Keep it safe.